anterior pelvic tilt. If you have anterior pelvic tilt and you don't care what it looks like, it's not causing you any pain, then this video is not for you. However, if you have anterior pelvic tilt and you have pain associated with it, or you just do not like what it looks like, this video is for you. My name is Dr. John Saunders. I'm a practicing chiropractor for over 18 years, and one thing I find, the more information that you have and the more active role you take in your recovery, you will get the best results. You might want to consider subscribing to this channel if you want to take some ownership and responsibility of helping yourself get better in the comfort of your home. This video is all about anterior pelvic tilt. It's a question I get asked many times in my office. How can you correct anterior pelvic tilt? If you have no problem with what anterior pelvic tilt looks like, typically people don't like it because what it does is as your pelvis rotates forward, it sticks out your bottom of your glutes and your belly. So some people want to rid it only because of what it looks like. However, oftentimes in clinical practice, I see it associated with low back pain, sacral pain, even mid-back pain can be associated with anterior pelvic tilt. So in this video, I'm going to show you what you can do in the comfort of your home to help alleviate and change that posture for good. Many people will explain anterior pelvic tilt from a pelvis perspective only, and while that has some bearing on your pelvic alignment, we often forget or neglect to look at the sacrum, the lumbar spine, and even the thoracic spine. Anterior pelvic tilt, when we look at the spine as you're standing up, because this is what we call upright posture, there is a slight anterior pelvic tilt between the PSIS and the ASIS. It should be between 4 and 10 degrees or so. That is normal. The problem is when this becomes excessive, we often will only treat or look at the muscles around the pelvis, but we also have to look at the sacrum. The sacrum will flex forward, it will cause your thorax to shoot forward, and then your low back will hyperextend, creating that anterior pelvic tilt. We want to address all of these problems in the spine and pelvis in order to address this properly. One thing is for certain, one area of the spine or one part of the body will absolutely influence the other part, and if you ignore the compensations that are happening, you will never fix a spinal or pelvis problem. In order to diagnose anterior pelvic tilt, the easiest way is to look at yourself in a picture or a mirror. Does it appear that you are in hyperlordosis? Does your chest shoot forward? Is your bottom sticking out? You can take your fingers and place the bump just above the sacrum at the back, and at the anterior front part of the pelvis, there should be a slight tilt forward. If that's excessive, well, that's what you're here for. That is what we call anterior pelvic tilt. There's a few parameters we want to measure. We want to look at the sacral base angle, the lumbar lordosis, the translation or the shift forward of the thorax in order to put together the appropriate exercises and treatments to fix the whole problem, not just simply the tilt forward of the pelvis. So there are a number of causes of anterior pelvic tilt. One is genetic predisposition. Some people are just born with structure that predisposes them to this type of posture. Oftentimes I'll see more of this posture prevalent in women. One of the reasons why? High heels. High heels force that posture. So ladies, if you're wearing high heels, this might be part of the problem. I'm not going to tell you to get rid of them because I know some of you love your high heels, but I'm going to say you have to work a little bit harder with the stuff I'm going to show you. Other causes of anterior pelvic tilt might be a structural abnormality. The only way to know if that's a cause is with x-ray. And then finally, we all know postural alterations, whether it be forward head posture, anterior pelvic tilt, posterior pelvic tilt, these are often due to lifestyle habits. How do we sit? Are we moving enough? Do we exercise? Are we stretching? Are we mobile? Or are we sedentary? These things contribute to postural alterations just like anterior pelvic tilt. Okay, for the first movement we're going to do, it's more of a warm-up. You want to see what kind of range of motion you have in your pelvis and your lumbar spine. So the first thing we're going to do is if you are stuck or you are favoring anterior pelvic tilt, in order to be successful in treating it, you need to be able to do a posterior pelvic tilt. So we're going to get on all fours, and basically we want to be in a neutral position, kind of your shoulder width apart for both your hands and knees, and you want to start in neutral position. So just to understand, anterior pelvic tilt is where your glutes or butt comes up and you have hyperlordosis in your lumbar spine or excessive curve. So this is the position we're trying to reverse. So we like to talk about mirror image. The exact opposite will be you come through and you tuck your tail or your sacrum in. And so we just want to go through some ranges of motion to see how much range you can actually get into posterior pelvic tilt. So we just want to move through maybe 10 to 15 reps. Some of you might only have very little movement. That is okay to start, but we want to make sure that we can actually flex and extend through those movements. So this is always a good movement or exercise to start to loosen the tissues up before you start to do some of these exercises. So hopefully now you have learned how to put yourself into posterior pelvic tilt in order to help and fix anterior pelvic tilt. So this one's going to be a very simple one. We're going to line our backs. And if you have anterior pelvic tilt when you're in your lower back, you're probably going to notice a significant amount of space between your low back and the floor or the bench, wherever you're lying. So for this, what we want to do is, we want to mirror image this. We want to rotate our pelvis through. So we're going to tuck. Remember, tuck our sacrum up. So as we tuck, we're going to flatten our back. We're going to activate our abs, take our belly button, and push it through to the table. And we're going to hold this for 5 to 10 seconds. And you're going to relax. And then again, we're going to pull. Again, we're going to pull and push through our abs, through our belly button, into our lumbar spine, right to the bench, to really flatten out the curve in our lower back, and then really focus on really squeezing that sacrum up. Again, hold that for 5 to 10 seconds. If this causes pain or discomfort, don't push as hard. You might take some time to create the range of motion necessary and to activate the correct muscles to be able to do this movement. But again, we have lots of curve here. If you're in anterior pelvic tilt, we want to push our belly button and squeeze our sacrum, focus on tilting our sacrum up, and hold 5 to 10 seconds. For this exercise, you're going to repeat 3 sets of 10 reps of 5-second holds. So this one will take a little bit of time, but you really start to feel the activation of the muscles needed to be able to create that posterior pelvic tilt, the mirror image of the anterior pelvic tilt. So for this next exercise, it's probably an exercise you've done because it's a great core stability exercise. This is going to have a slight modification. I'm going to show you a posterior pelvic tilt dead bug. The first movement is we're going to get our knees up and hands up. What we want to do is we want to make sure we're really excessively doing a posterior pelvic tilt to oppose the anterior pelvic tilt we're trying to fix. So we're going to lift our legs up and we're going to really pull our sacrums up as we do this. And we're going to hold this as we typically do the dead bug. And it takes some concentration because you're going to want to lose that posterior pelvic tilt as you go through this exercise. You will really start to feel this in your sacrum area, in your lower back, in your abdominal area at the front. So again, really focus on pelvic tilt, sacrum up, tail tucked up. Really focus in slow movements. If it's too difficult to do it this way with all fours, you can start simply with your legs. If it's too easy, grab a couple 5-pound or 2-pound dumbbells, and again, off you go. We're going to do this 3 sets of 12 to 15 on each side. Okay, we're moving along here. The next exercise is going to be a similar one. If you've had any low back issues, hip issues, you've probably done it. We're going to do posterior pelvic tilt with glute bridges. The same thing. We're going to get on our back and activating a weak glute. It goes a long way in helping anterior pelvic tilt. The thing is, what we want to do is we want to actually, again, tuck our tail in, get that posterior pelvic tilt before we even start the movement. So if this is normal, get that really excessively poked in, or poked up, I should say. Fire the abs, fire the glutes, and really squeeze at the top with a 2 to 3 second hold. Try not to let go of the posterior pelvic tilt when we get to the bottom. Hold it and really squeezing the glutes. If you've never done a glute bridge holding a posterior pelvic tilt, you're going to really feel the difference. Now, if it's easy, again, you can go on one leg. It's much harder to hold that posterior pelvic tilt on one leg, but it still really works the glute very well. So I want you to do 3 sets of 10 to 15 reps of those glute bridges with a posterior pelvic tilt immediately following the previous exercise. Okay, this is one of my favorite and probably one of the best exercises I feel and that I've seen clinically to really help with anterior pelvic tilt. The reason being, it takes into consideration what we talked about at the beginning of the video. It takes into consideration not only the pelvis tilted anteriorly, but also the sacral base angle, the excessive sacral base angle. It takes into the account the excessive, typically the excessive hyperlordosis or curvature that we find in the lower back, and it also takes into that thoracic translation or that forward shift of the thoracic cage. For this one, you are going to need a piece of equipment. The simplest thing is a pretty thick, hard pillow will do, a foam roller will do, anything that's circular that you can put in the belly of your hamstrings will work. You want your feet to be just like you would standing. The only difference is you're going to squeeze, you're going to lean your body against this. So with excessive anterior pelvic tilt, you're going to be like this standing here. So in order to mirror image that, we want to pull our thorax back to the wall. At the same time, we do that posterior pelvic tilt. So we're taking our belly button and trying to stick it to the wall. So hands up here is always a good way to do this. And then we're going to do the opposite movement. We're going to pull in and really fire the abdominal wall and hold for 5 seconds. We're going to do this 50 times with a 5-second hold. Again, try to get that lumbar spine against the wall and really squeeze when you get in there. Squeeze your glutes, squeeze your abs, flatten that lumbar curve. This is, while it doesn't look hard, it's a very difficult movement and it actually takes a lot of concentration. Like I said, we want to do 50 reps of this, but you might only be able to start out with 10, 3 sets of 10, 2 sets of 10. It doesn't matter. Increase as you're able to. One final exercise that's an excellent exercise that some of you may have done, but the key here is doing it in conjunction with the first 5 movements or exercises I've showed you, and they're simply lunges. Lunges are great because you can put yourself in a position, a very controlled position, where as you come down, and these are not the right shoes to be using, but I'm going to show you this for demonstrating purposes. You want to come down and you can keep your upper body, your shoulders back, your head over top of your shoulders, and we can come down and really get a good stretch on the psoas muscle and a really good activation of the glute on the opposite side. So I love even just body weight lunges are very good. You want to do this 3 sets of 12 to 15 on each side. And again, if this is easy for you because this is something you do, then grab a bar, a front squat position, or some dumbbells. But you don't really need it because the focus should be on really keeping your pelvis stable, keeping your shoulders back, your head over top of your shoulders, getting a good stretch in your psoas, and a great activation of your glute. I know if you apply what I've just showed you in a routine multiple times a week, you will notice a change in your anterior pelvic tilt. If you like this video, please give me the thumbs up. And if you have a question, leave it in the comments below. I'll try and answer every single one of your questions. And if you have a future topic idea that you'd like to see in one of these videos, please put it in the comments below and I'll make sure I add it to my list. And as always, if you found it beneficial and you like videos just like this, you might consider subscribing to my channel by hitting the subscribe button below and the notification bell. I look forward to seeing you on my next video. Until then, stay well.